In this lecture, we are going to learn about immunity, the immune system of our body. Immune system of our body is a part of the inflammatory system. Now, what is the basic organization? So, basically, our body has a immune system which is of two types. One is when it is giving a very non-specific response against the antigen, and the other is when it gives a very specific response against the antigen. So the non-specific response is also called as an innate immunity. It is a kind of a generalized response, and a specific response is called as an acquired immunity. That is acquired. It is not naturally into the body. It is acquired over some period of time. Now, what is an innate immunity? So, as I've shown in the diagram, a pathogenic invasion or a bacteria or virus can happen and the immunity fights against that pathogenic invasion. So, what are the first line? What is the part of the innate immunity? There are two parts, first line and the second line ones. The first line ones are called as skin, the ciliated cells, the lysozymes which are present in the cytoplasm of the cells, even the reflexes like coughing, vomiting are all part of your first line of defense. So you know, right, like if there is any microbe that is on our skin, it will not enter unless there is any cut or anything like that. So skin serves as a barrier. It is a natural defense mechanism. Ciliated cells are the cells which line our respiratory epithelium, and they help in moving the particles. So if there is any foreign particle that has entered along with the air that we inspire, then those particles get caught in the cilia of the cells and they are expelled out in such a slow speed that we don't realize, but yes, they are expelled out from the respiratory mucosa. Lysozyme are the cells which are in our cytoplasm of our cells, and they are those part of the organelles of the cell which help in destroying the microbes. They contain all those enzymes which can destroy the microbes. And coughing and vomiting are the reflexes. You know, whenever you have any bad smell or any smell which is irritant to us, we start coughing immediately. If we eat some food which is not good for our body, it is going to vomit out all the food whatever is not good. So that is also considered as a part of our first line of defense mechanism. Second line of defense mechanism is formed by the blood clots, by the histamines which are released by the mast cells, by the cytokines, those chemical mediators which are released by the macrophages, and all those leukocytes, neutrophils, lymphocytes, they all form the second line of defense. Now coming to, that was innate immunity. Coming to the acquired immunity. What are the types of acquired immunity? There are two types, natural and artificially. Either the body will naturally acquire it or it will artificially acquire it. And there are two modes of acquiring it. Either it is an active mode or a passive mode. So which can be called as a body has naturally acquired but in an active state. So whenever we have any infection like influenza, like whenever we get all those sneezes and all those virus infection, and the body resolves and fights and gets healed on itself, that means at that time it has got a naturally acquired, it develops a naturally acquired immunity which is of the active form. And when it is passive, when the antibodies, when they are passed on from the mother to the fetus, those are considered as part of the passive, naturally acquired. Both of them are naturally acquired, both of them are naturally made by the body and passed on, and one of them is made by active process, another is by a passive process. You didn't ask for it, you got it from the mother. I have to make a note over here that generally this passive acquired immunity is shorter duration. Whatever antibodies that you acquire from your mother are for a shorter duration. If I'm not wrong, up to I think 3 to 6 months of age only that works. After that, the baby's body itself starts making the antibodies. Okay. Now we're coming to the second part, that is artificially acquired. Now artificially acquired can again be an active form or a passive form. So active form includes all those vaccines that are getting injected into you. They may be dead or attenuated vaccines or any pathogens that are injected in the form of vaccines. They all act as artificially acquired. You didn't get the infection, but you are trying to develop antibodies against it. So by taking an vaccine. And passive is when you know that you have got a disease and you want a specific antibody working against it. So like when you have Guillain-Barré syndrome, which is a nervous system disorder, and you know you need immunoglobulins to treat it, so you directly get injected with immunoglobulins. So that is a passively acquired antibody, passively acquired artificially immunity. Okay. Now active immunity, again looking at why it is called active, because there is a production of antibodies against a specific disease by the immune system, and they are naturally acquired through the disease, artificially acquired through vaccination. This is again this chart. Okay, so this column and this column I am discussing again, like naturally acquired by the infection and artificially acquired by the vaccine. Okay, and it is usually permanent. Now, a vaccinated person has a secondary response based on the memory cells when encountering the specific pathogen. So, what happens when you get a vaccine? When you get a vaccine, your memory cells will form those antibodies, and those specific antibodies will work against those specific infection. Now, routine immunization against infectious diseases such as measles and whooping cough has led to the eradication of smallpox, a viral disease. So why we need to take vaccines? Because by taking vaccines you are trying to eradicate the disease. So if you are vaccinated against measles, you are not going to develop measles because your body already has the antibodies to fight against it. So we keep on immunizing till the point that you see no new cases of the disease, which has happened in the case of smallpox. So no more new cases of smallpox are seen. Why? Because people kept on getting immunized, and so finally the virus, nobody was able to get the virus. Everybody is immunized totally, and the virus has totally gone. It has eradicated. Okay. The only unfortunate point is that not all can be managed, right? We know HIV infection is still there, no vaccine is developed against it, and it is considered as one of the endemic disease, which is pandemic, sorry, which is going on around the world and in a very large quantity than we can even measure. Okay. So that was about active immunity. Now coming to passive immunity. Passive immunity is the protection against the disease through antibodies produced by another human being. Again, in this chart we saw this one. This is the passive immunity and this is the passive immunity. Here also the antibodies were made by the mother. The baby didn't make it, right? So the mother made the antibodies and passed into the baby. And here the antibodies were either made in any animal or any other place, and then they are injected to the patient. So that is passive immunity. It is effective, but it is temporary. As I said, they are temporary. Like maternal antibodies, colostrum, they are all temporary only till the time that for certain time they stay in our circulation. Okay. Passive immunity can be transferred artificially by injecting antibodies from an animal that is already immune to a disease into another animal. So this is what they do in the rabies treatment. So injection with antibodies against rabies virus that are both passive immunization and active immunization. So what happens is whenever you get infected by a dog which had a rabies infection, you get both the things because rabies is such a deadly virus, so you need both passive immunization also and active immunization. So because you are actively bitten by the animal, you need those active immunization which are going to fight against the microbe at that time, and also because these viruses tend to live in our nervous system and they may manifest at a later stage, we also need the passive ones so that they can also stay in the circulation and keep on fighting against those viruses. So both the immunizations occur when you have a rabies infection. Now immune system responds to antigens. There is also something called as humoral immunity. I know there is many. All these are just different types of classification. They are basically immunity, and you all need to know is natural, artificial, active, passive. Now humoral immunity is another classification of the immunity where there are antibodies produced which are secreted from the B cells dissolved into the blood plasma. It is demonstrated as an immune response using only the blood serum, and it generally is working against the bacteria and their toxins and the virus infections. Okay, so humoral immunity is generally considered when you have antibodies which are working against these microbes. Antibodies constitute a group of globular serum proteins called immunoglobulins. So there are immunoglobulins, those antibodies which are formed by the bodies, by our human body, are a part of the family of immunoglobulins. A typical antibody molecule has two identical. Now from this I have jumped to the structure of immunoglobulin. For your information, you need to know what does a immunoglobulin molecule look like. Okay, so a typical antibody molecule has two identical antigen binding sites specific for the epitope that provokes its production. What I'm trying to say is, this is the antibody molecule, this is how it generally looks like, and there are two sites where the antigen can come and bind to the antibody. Okay, and what is the antibody? This immunoglobulin, and that is another name for immunoglobulin is antibody. Okay, because they go and fight against the antigen, so they are the antibodies. So this is the structure of antibody. There are two light chains of the antibody and two heavy chains. Now two heavy chains generally stay constant and the light chains may change. Okay, based on the light chains, the structure of the immunoglobulin changes, the classification of the immunoglobulin changes. Okay, so two light chains, heavy chains, and that is the antigen binding site. This is just to show you how the antigen comes and binds over there. So here we were discussing antigen. You can see over here, this is the place, this is just an example to show how the antigen will come and bind at its antigen binding site. Okay, now this is like a classic diagram of an immunoglobulin. Here you can see these are the two light chains which are also called Fab, and this is the heavy chain which is also called as FC. FC stands for the constant portion, the constant portion of the immunoglobulin. Okay, here you can see how they become different. Like IgM, you can see there are like five structures together, they are forming like a circle like a thing. IgG is generally like this, two wings like a Y shaped. IgA is like these, two attached opposite to each other, and IgE has like a bit of an elongated structure, and IgD is like it's the IgD is like a bit vague, but this is how the structure looks like. Okay, now come in this, the other discussion we have to do is IgM is generally the first one, the first immunoglobulin that comes into action whenever there is an antigen. IgG is the one which is easily transportable, like from mother to baby, the immunoglobulins that you get is IgG. Okay, IgA is always present in our mucus, tears, saliva. So IgA always, that is the antibody which fights against those places, right? If you have an infection of the eye, if you have something going through your nose or through your mouth, then the antibodies which will come to fight are IgA. IgE are generally when you have any allergy, like any hay allergy or any allergy, or when you get any parasitic infection, like you have those GI infections, right? So there is the place where IgE immunoglobulin will come and act. IgD is kind of like a B cell receptor, and there are not much functions defined to it. All I know is that it acts as a kind of receptor, like calling the other cells, other B cell lymphocytes to come and fight at the place. Okay, so what is the response to an antigen by our immune system? It is called as a cell mediated immunity. What is a cell mediated immunity? It involves the activities of the specific white blood cells and defense against cancer cells, virus infected cells, fungi, animal parasites, and foreign cells. All these is the place where the cell mediated immunity acts. So you recall, if I earlier said there was another classification which involved humoral immunity and cell mediated. So humoral immunity had antibodies, right? Antibodies which were working against bacterial and their toxins and some viruses and some examples like that. And this is the cell mediated immunity. Cell mediated immunity is where T cells come into action. Humoral immunity generally involves the B cells and plasma cells from which you get the immunoglobulins, whereas cell mediated immunity is generally involving the T lymphocytes, and it is generally active against your cancer cells, virus infected cells, and fungi and all those places. Okay, Now, from that, I jump to B and T lymphocyte formation. I know the slide is a bit in the between, but I'm just trying to tell you how the lymphocytes are formed from the bone marrow or the fetal liver. When you are a fetus, your liver produces the lymphocytes and all those WBCs and cells. When you become a child, or when you're like infant and you come out of the mother's womb, then the development goes into the bone marrow. Okay, so the lymphocytes are formed in the bone marrow and they get matured. How do they get matured? They get matured into B cell in the bone marrow itself. But some of the population goes to thymus gland, and there they get matured and form into a T cell. Okay, so that is how B and T cells are formed. B cells are formed in the bone marrow itself, and T cells are when some of the population goes to the thymus, and then they get differentiated into T cells. And then both B and T cells go into the circulation and into the secondary lymphoid organs like lymph nodes, spleen. Some of them are in the circulation in the blood, and some of them go to the lymphatic system, form part of the lymph. Okay, that is what this B and T cell migration is about, that after maturing from the bone marrow and from the thymus glands, they go to the secondary lymphoid organs like lymph nodes, spleen, tonsils also, and some of them also go to the external body surfaces like intestines, respiratory systems, urinary system, reproductive system. So all these systems, there also you have small collections of lymphocytes to fight against all those bacteria and viruses and all those antigens. Okay, now, how does an immune system, how does it get activated? We know how does an immune system get activated. Whenever an antigen enters the body, the immune system starts getting activated. Okay, and how what are the structure and the location? So first the immune system will tag the antigen, and then it will disable it. That is the main function. And what are the cells which will be doing it, like which are the cells of the immune system? They are the T cells, the macrophages, and all the other leukocytes. They will help into this function of antigen binding with the antibody, and hence they disable the antigen and they try to protect the body against the infection or antigen. Okay, now cell response. B cells, what do they do? B cells recognize the antigens, they proliferate and they produce specific antibodies, differentiate into plasma cells to produce even more antibodies, and some of the B cells differentiate into memory cells to keep the antibodies in supply for activation from second encounter by the same antigen. So what is the function of the B cells? Most of the times B cells produces the antibodies to fight against the infection. It not only does that, it also forms some cells get converted into the memory cells. So what will be the memory cells do? They will keep a memory that okay, when this antigen comes, this antibody should be formed, and this is how the antigen antibody reaction takes place in the body, and this is how the body can control it. Okay, so those is the function of the memory cells. And what else will the B cells do? They will start differentiating into plasma cells. Because plasma, why plasma cells? Because plasma cells can produce even more quantities of antibodies, more quantities of immunoglobulins. Here, this is just the diagram or the chart trying to show you. So here you can see this is the antigen A. Here the B cells are coming, they recognize the antigen, they proliferate the B cells, and they have produced the specific antibodies to act against it. You can see here, this is the B cell. It came here, it started proliferating here, and it started differentiating. So and then after differentiating and getting fully formed, it formed the antibodies to act against it. Okay, and some of them will also form get converted into memory cells. Okay, so here you see differentiate into the plasma cells to produce more antibodies, and some of them, here you can see this population is going this side and it is forming a memory cell. So some of them are forming antibodies to fight over here, and some of them are forming the memory cells to keep them for the later. Okay, this is how the B cells act against the antigen. Now what do the T cells do? The T lymphocytes, they recognize and destroy the tagged antigens and proliferate. So basically B cells, they don't themselves work, they release the antibodies, whereas T cells, they themselves go and fight against the antigens. Okay, so cytotoxic T cells, they bind to the antigen on the plasma membrane of target cells and directly destroy the cells. Helper T cells, there are two types in T cells also. So there is one cytotoxic which will go and bind and kill it, and then there is helper ones which will activate the B cells also, that okay, I cannot fight against this whole thing on my own. It will also call the B cells, it will also call the cytotoxic T cells, it will also call the natural killer cells, the macrophages, and all the whole army to fight against the antigens. Okay, so that is what helper T cells does. Remaining cells can respond to the secondary infection. So so that is what the cell response of T lymphocytes, T cells looks like. That was what normally happens. That is how our immune system normally works, by its B cells, by its T cells, and all their functions. So B cells producing the antibodies, also producing the memory cells, T cells going and directly fighting, also the helper T cells trying to call in more army. All this is the antigen, and all these are the immune systems. What happens when sometimes the immune system starts goes abnormal, it starts behaving in an abnormal way? So then the diseases that are formed are of these types: autoimmune, allergy, and immunodeficiency. Okay, these are the conditions. This is just a generalized category. Okay, so some of these diseases are put in the autoimmune category, some of the diseases are put in the allergy category, and some of the diseases are put in the immunodeficiency state. What happens in all these three categories is the immune system, the which is supposed to protect us, is overworking, or it is not working properly. It has become abnormal. Okay, so what are the examples of autoimmune diseases? What basically happens in autoimmune diseases, those antibodies, you remember the antibodies that were getting formed from the B cells, which are supposed to protect against the antigens. Now what happens is sometimes our body starts producing antibodies even against the normal antigens of the body. Okay, like for example, you can say there are some antigens on the thyroid. So the antibodies, our body, if it becomes abnormal, the immune system goes abnormal, it will start producing antibodies which work against the normal antigens of the thyroid cells. That disease is called as Graves' disease. The same thing happens with type 1 diabetes. So the insulin receptors which are supposed to work normally, the beta cells of the pancreas which are supposed to secrete the insulin normally, but the antibodies start acting against those beta cells, hence they kill the beta cells, and so insulin is not getting formed in those conditions. That is type 1 diabetes. Okay, myasthenia gravis is the condition when there is nerve we have we have neuromuscular junctions, like the nerves and the muscles, they get together to conduct the impulses. Now there are some antibodies which form, there are, they work through releasing chemicals, right? But sometimes there are some antibodies which act in those places, and so the muscle cannot get those responses, and the muscle weakness, those kind of symptoms start happening. That is another. Next is autoimmune hemolytic anemia. What happens in autoimmune hemolytic anemia? Anemia, we know, decrease in RBC. So RBC, how do you identify an RBC? Either it will have an A antigen on its surface, or it will have a B antigen on its surface. Now the antibodies will be, if there is an A antigen, the antibodies will be B. If there is a B antigen, the antibodies will be A. But sometimes there are there are A antigens on the RBCs, and by mistake or by an abnormal reaction, antibodies A start getting developed. Then that condition is called as an autoimmune hemolytic anemia. So those antibodies were not supposed to be formed, but they have started getting formed. And so what they do, they bind against the A antigen on the RBCs and they break down the RBCs, hence leading to an anemic condition. That is an autoimmune hemolytic anemia. Sjogren's syndrome is again another those kind of antibodies which are formed, and they cause dryness of mouth and all those kind of symptoms. Rheumatoid arthritis, we know it's a joint disease, so where there are all those antigens on the joints which help in the smooth functions and the movement of the joints. Instead, there are antibodies which are working against those places, and so the joints start undergoing complaints of pain and swelling. SLE, systemic lupus erythematosus, which is a very common disorder and a very important one, very commonly seen in the females, because females tend to develop antibodies more because of so many hormones and so many things going on in the body. So the systemic lupus erythematosus is where a lot of antibodies are getting formed, and they are like kind of systemic. So they affect all the different parts of the body. They can affect the kidney also. They can cause a simple disease like rashes on the face to very serious ones like affecting the function of the kidneys. They can also affect our eyes and cause vision problems. So systemic lupus erythematosus is like kind of a very what do you call, a grand autoimmune disease. Okay, that's why I've included a separate slide on it. It was found that there are some genes also which are working abnormally. There are also some antigen presentation which are wrong. There is also like the innate immunity is overworking in these cases, and sometimes the adaptive immunity starts working wrongly. Okay, now what are the genes which can work? That is also found. They did some studies and they found that there are some genes. They also said that there are some environment. There has to be reason why our immune system goes haywire, right? So they found that there might be UV lights or smoking or any infection, EBV infection, that can also lead to SLE formation. And there were also some cases where they found that even genes, the hypomethylation and the histone modifications and those kind of genetic defects have also led to formation of autoimmune antibodies, which are leading to the condition called as SLE. Okay, and these autoantibodies are getting formed, and B and T cells. It is also causing a rash. It is also affecting the kidney. It is also affecting the joints. It also causes a decrease in the WBCs. It can also become very severe and affect the brain. And generally, because of those chronic infection, chronic inflammation, the kidneys and blood vessels are getting affected. Okay, now that is one of the autoimmune disease is one of the type. Now when the immune system goes abnormal, it is also called as hypersensitive condition. Okay, hypersensitive condition is an altered immunologic response to an antigen, and it is again, as I said, abnormal response. Okay, these all the abnormal immune responses come under hypersensitive reactions. Now hypersensitive reactions can be classified on the basis of two things: either by the source of the antigen that is affecting, that is, it can be called as an allergy or an autoimmunity or the alloimmunity, or it is classified on the basis of 1, 2, 3 and 4, which we'll see shortly. Now what are the types of the hypersensitivity reactions? Type 1 includes your IgE mediated, all those allergies, allergic rhinitis, asthma, anaphylaxis, all those conditions come in type 1 hypersensitive reactions. They are generally immediate reactions. They occur like within seconds to minutes, okay, like 5 to 30 minutes. And generally the cells which work in this activation are the mast cells, okay, and those conditions are called as allergic rhinitis, asthma, anaphylaxis, all those. They all come into the type 1 hypersensitivity reactions. Now type 2 are where it is called as complement mediated. So what happens over here is a complement mediated phagocytosis occurs. But it is generally an antibody mediated cytotoxic hypersensitivity reactions, and it takes minutes to hours. Okay, this was like 5 to 30 minutes. I said it was very rapid. This takes a little bit longer than that, so minutes to hours. And it is IgG or IgM mediated, and the examples are drug allergy or a Graves disease or anemia like autoimmune hemolytic anemia. They all come under type 2 hypersensitive reactions. Okay, type 3, now as I said, there are two different types of classification. So diseases come in both, right? We did here, like, remember, allergy, one classification is based on the antigen that is affecting, and one classification is 1, 2, 3, 4. Simple. So examples of the diseases will be common, only the basis of their classification is getting different. Okay, type 3 is where there is 3 to 8 hours. So this was 5 to 30 minutes, then minutes to hours, and this is like even in hours more, 3 to 8 hours. So what happens over here is there is a tissue damage. Why? Because of the immune complex that is getting formed. How does the immune complex get formed? By the antigen antibody reactions happening, and all those get binded together and they form a complex. That is called as an immune complex. And it is an immune complex mediated hypersensitivity reaction. IgG, IgM soluble antigen. And what are the examples of the diseases? Rheumatoid arthritis, serum sickness, SLE, they all come into the complex mediated hypersensitivity reactions. Okay, Now last one is the type 4 one, which is based on the, it is called as a cytotoxic ones. Okay, and it is generally by the T cells, and it is a cell mediated hypersensitivity. And how much time does it take? It takes around 2 to 3 days, 48 to 72 hours. And the examples of type 4 are contact dermatitis, graft rejection, chronic asthma. So whenever you have like graft, any graft is placed on a person, and if it is getting rejected, now it should not ideally get rejected, right? Because it is supposed to be accepted, it is a normal place there, but the immune system starts working against it. Our T cells are not happy with the graft, and so if they are not happy, they cannot adjust working with the graft, then they will reject it. So that graft rejection comes under the type 4 hypersensitivity reaction. Just to be detailed, I have included an example of type 1 hypersensitivity reaction, allergy, because it is very commonly seen. Okay, now what happens in this is, this is a mast cell, these are the antigen antibody reactions happening. The antigen has come and attached to the receptor on the surface of the mast cell, and as soon as the antigen attaches, the mast cell starts releasing its histamine. So that because of the histamine release, the reaction starts happening. Because of the histamine release, the inflammatory process starts happening. Okay, so binding of IgE, that is the immunoglobulin, to the mast cells, repeat exposure happened. This was when the first exposure happened. When there was a repeat exposure of the antigen, the mast cells started getting activated and it started releasing the mediators. That is how you get an allergic reaction. You do not get an allergic reaction at the first exposure. You get it at your second exposure. The first exposure, your mast cells are ready that this is not acceptable, and as soon as you get exposed to it again, they will start bursting and they will give you a reaction. Okay, ideally, why is it an abnormal thing? Because ideally your body should fight against it and try to control it, but here the body will try to give out rashes and sneezing and coughing and severe reactions. So it is an abnormal reaction, you start getting worried. So that is why it's an abnormal immune reaction. Okay, but it is also in a way good, because then you go and take treatment, because your body is not able to fight against it. Okay, so now what are the mediators that are getting released? They are the vasoactive amines and the cytokines. Cytokines generally cause the late phase reaction, and vasoactive amines come into the immediate, like minutes after the exposure. Okay, now as just to tell you, this slide is for improving your knowledge. What are the antigens? So here you see A. So this is the RBC, and what is it having? As you will look over here, the common structure, this is galactosamine, this is fructose, and this is NAG, N-acetyl. Let's not get into the details, but this structure stays the same. In A, here you have NAGA attached. In B, you have galactose attached. Okay, and in AB you will have both of them, like NAGA also and GAL also. And when you have O, it is only these three: galactose, fructose, and NAG. So you saw, this is the basic. When you have NAGA attached, it becomes A. When you have GAL, galactosamine, attached, it becomes B. And when you have both of them, you have AB blood group. That is how you get the blood groups: A antigen, B antigen, and this is the structure of the antigen. Okay, and what are the antibodies that are getting formed? Antibody B, antibody A. In AB you will have none, because A and B both are present, and in O you will have both the antibodies, A and B both. Why I needed to include that slide is so that you know why the transfusion reaction happens. So by chance, if a person who has a A blood group and you give him B, so there are B antibodies in the circulation, right? So B antigen on the transfused blood and the B antibodies will start reacting in the person. It will cause a reaction. Okay, a very bad reaction for that. So that is what is a transfusion reaction. It is called as a transfusion reaction. Sometimes this is giving B blood group to a person is like a very big problem. Okay, that never happens, but sometimes even when you are giving blood, a person getting A blood group same, still some antibodies are present in the transfused blood. So that antibody can also cause reactions. So what are those reactions? If there is like mild itching and hives and reddening and rashes, it is mild allergic reaction. Sometimes the person can develop fever or chills. Then it comes into a hemolytic reaction. Sometimes a patient can develop very severe reaction like low blood pressure or a difficulty in breathing. What do you do when you see? So whenever you have a blood transfusion reaction, the first thing that the doctor does, it tries to reduce the immune system. So they will give steroid injection, they will try to reduce the immune response so that the transfused blood can be accepted by the person. But and then they keep a very strong monitoring of the person who is getting the blood. But sometimes, when even after giving the thing, if you are not able to keep an eye, then if the person is not able to keep the transfused blood, it will give reactions. What are the reactions? They may be very mild from hives, or they may be very severe like difficulty in breathing. And if you see any such symptom in a person who is getting blood, the first thing that you do is stop the blood transfusion immediately. Okay, so first thing you do is stop the blood transfusion immediately. That's why even when you must be knowing, when you're moving around in the wards and blood is getting transfused to the patient, and you will keep on asking, you take their temperatures, you take their blood pressures, and you keep an eye. And if anything itching or redness or anything they develop, that means some transfusion reaction is going on. So the first thing you will do is stop the transfusion. Okay, this slide is included just to cover up the remaining topic, that is the immune deficiency. So sometimes some people do not have the normal immune system which is supposed to be there. So what are those conditions? Either it can be due to a primary problem, either there is an absence of the enzyme or the absence of the whole cell type only, or there is something which is not functioning properly. Now whenever there is a primary immune deficiency, you will know it right from the childhood, right from the child, from the age the child is born. If it continuously keeps on getting infected, you know that the primary immune, it is a primary immune deficiency. Okay, child never developed its immunity, so that is a primary immune deficiency disease. If you have seen that movie, there is a movie on a bubble boy. The boy lives in a bubble. Why? Because it has no immune system developed in it, right? So that is a primary kind. Sometimes some people acquire those conditions where your immunity goes down. So what are those conditions? Either the malignancy, or the HIV infection, or a malnutrition, not eating food properly, or any drug like steroid or any immunosuppressant drug which is suppressing your immunity. So those are the conditions which come into the acquired, and they generally can manifest at any age, right? Primary, since birth only that something is wrong, but here this is acquired later in the stages, so it can manifest at any age. So this is about the immune deficiency. This was all that I had to teach about immunity. If you have any doubts, you can ask me in your email. Okay, thank you.